2 p.m. right here on AM 950, or listen anytime by finding Boldly Challenging Ableism on YouTube or your favorite podcast app.
With a look at your AM 950 forecast, this is Adam. 66 clouds and rain for today. Tonight, clouds and rain, a low of 61. The Great Wall Restaurant, specializing in Szechuan and Peking Mandarin cuisine, has menu favorites like hot and sour soup, sesame chicken, and beef and broccoli. Conveniently located at 4515 France Avenue South. Call for takeout 952-927-4439 or greatwallrestaurant.us.
Portions of the following program may be pre-recorded.
Hello, everyone, and welcome to Living Healthy and Aging Well. My name is Ken Haglind, and we are broadcasting from the AM 950 radio station that overlooks beautiful Bryant Lake Regional Park located in Eden Prairie, Minnesota. It is another wonderful day here in the Twin Cities, and I am so grateful to be here with you today, and I hope all of you listening are doing well. We are on the air every Saturday from noon to 1 to talk about your health and your life. We cover a wide range of topics to help you and your loved ones improve and enjoy your quality of life. We have another great show for you today. Joining me in a few minutes will be Tyler Leonard, president and caregiver of SeniorAsset. And he is going to share how his companion care services can help improve seniors' quality of life and give peace of mind to their loved ones. After a head injury forced a career change, Tyler founded his business in 2021 and began helping seniors. Tyler spends one-on-one time with seniors doing various activities based on the client's needs and interests. This is the primary form of in-person social interaction for many of his clients. For others, Tyler provides respite care so that the primary caregiver can recharge. Because Tyler is both SeniorAsset's owner and caregiver, he can provide both continuity of care and rapid and thorough updates to loved ones. We'll dive into all of this along with real life examples as we share how SeniorAsset can help your loved one. Tyler will also discuss other services he offers, such as medical appointment transportation, advocacy, and technology assistance, which is a big deal. You'll enjoy listening to my conversation today with Tyler Leonard. I want to thank all of you that leave us messages on our radio show phone line. We appreciate hearing from you, and we welcome your comments, questions, and of course, topics for future shows. Also, if you are interested in being a guest on our radio show, please call or text us at 612-999-3426. Now, you can also contact us on our website at livinghealthyradio.com. There you can find information about upcoming guests as well as listen to our previous shows, and we look forward to hearing from you. We are adding new listeners to the show each week, not only here in the Twin Cities of Minnesota, but also throughout the country. You can find podcasts for all of our radio shows on the AM 950 radio website. And we can also be found on iTunes, Spotify, and many other podcasts and streaming services. And you can also watch our broadcast live on the radio station's Facebook page at AM 950 Radio. If you have a question for us today, there are two ways to reach us. First, by calling the AM 950 radio station, and our friendly show producer, Adam, will get your call on the air. Our phone number is 952-946-6205. Once again, 952-946-6205, or you can directly text us your questions at 612-999-3426. Now, don't worry. If you missed our contact numbers, I'll repeat them throughout the show. All right. I want to jump in here to my interview with Tyler Leonard, president and caregiver of SeniorAsset. Welcome to the show, Tyler.
Thanks.
Great.
Thanks for having me.
Yes, great to have you here. I just love having organizations and professionals that their life's work is to take care of others. That to me is just such a great field, and the field that I'm in parallels your field. Our organizations, our professions work so closely together to make sure we take care of people seniors and people that at end of life as well. Well, let's start off with, who are you? What's your bio? What's your background? Give us a little bit of a background about you. I mean, I did mention on the introduction that you had incurred a head injury and that caused you to shift careers. And I told you earlier before the show started, many of my guests have done career changes mid-career. And so it's very common to have that. So I'm really curious about your story.
Yeah, I can dive into that. So I guess long time ago, I grew up in South Carolina. I came up here for school. I went to Carleton College down in Northfield. Got a degree in economics. I met my wife a little bit after graduating. She's a Minnesotan, so
good lady. Yeah.
It got me stuck here. There's worse places to be, though.
For sure. Yeah.
So yeah, and then I got a job as a business analyst at a manufacturing company. Kind of anticipated doing work similar to that for my whole career. I was traveling with my wife. Dumb story, just had moved the couch cushion, forgot about it, hit the back of my head on a wall, got a concussion. Yeah, it's started working again. Just symptoms kept getting worse. I tried working part-time for a while, wasn't working out. And kind of long story short, I guess I can get into more of that part of the story too, but I had to change careers and ended up doing this.
Yeah. Wow. But you know what I found is that when people either voluntarily or involuntarily change careers, they tend to find the career that was meant for them in the first place. Did that happen to you?
I think so. Yeah. I mean, I enjoyed parts of being a business analyst. I didn't enjoy doing it as many hours as I was doing it, but you don't really have a sense of purpose. You're just helping a company make more money. And this career, I'm actually helping people directly. You can see, when you have a good time with the client and you drop them off and they're happier, and the loved ones are happier because they know their loved one is in good hands. So yeah, I do think this is, it's a better career fit for me. Tangent, but I've also enjoyed referring to other places. I can touch on this more later, but formed a group with some other small companies, and we all refer to each other, and just help, even if I'm not directly helping someone, but helping seniors and their families find other resources and help other small companies serve people is something I enjoy too.
Well, it's very complicated to navigate through life right now. It seems like it's I know when we meet with people, they're just confused. They don't know where to turn. I mean, we have all these amazing resources. Well, I've been doing this for 7 years, and one of the goals of the show is to be able to match up with people with needs and resources, and it's never ending. I mean, I hope to do this show for many more years, and I'll just be scratching the surface because there's just so many resources, but people just don't know where to turn, and they don't know who to trust.
Well said. Yeah. I mean, that's what I've heard. I think it's over 10,000 people turn 65 every day. Aging population
across the nation. That's right.
Yeah. And it's just, like you said, it's really tough to find resources and figure out who to trust. I mean, I guess that's one thing that I really like about my business model.
Yeah.
So it is. Yeah. So I started in 2021, fall of 2021. I've been doing this about
right after the pandemic.
Yeah. Interesting. I mean, I'm glad I didn't start in the beginning of 2020.
Right.
But so I basically my physical therapist put me in touch with a woman in Northfield who didn't have a background in this, and she started her own business. She convinced me to start my own. I mean, my business model, it's just me. So you don't have to worry about, maybe you get a good caregiver at a bigger agency, you lose them. the kind of, you don't have to deal with caregiver turnover. You get that continuity of care, and you build a relationship, build trust. Because my clients and their loved ones, really trust me to take good care, and then also to, I'm often reporting back to a loved one, so they trust me to keep a good eye on their the person that I'm working with, and keep them in the loop.
Yeah. Well, I think one of the things I've learned over the years, whether it's in hospice or in caregiving, communication is so vital. And I think that's where, as I talk to families and referral partners and communities and seniors, that's the one area that they wish they could have a better service in, is the communication, because it is so important. When you're there, you're right there with the loved one, and at whatever stage that loved one's at in terms of the care needs, it's so important to get that information back to the family members or the primary caregiver or whoever you're helping out, because it really means a lot to them to know, is there been any change in the person's status and their health and their well-being. It's just all so important in that communication. That's why it is nice to have someone like you who is the caregiver.
Yeah. Well said. I have a lot of clients that do depend on that direct communication. And for instance, I've got a client that I take out every Wednesday. We go, I check him out on memory care. Like, we go visit his sister. All
right. Well, I'll tell you what, why don't we get back to that? Hold on to that story, Tyler.
Okay.
It's time for a short break. We'll be right back to continue our conversation with Tyler Leonard, president and caregiver of SeniorAsset. And he is here sharing how his companion care services can help improve seniors' quality of life and give peace of mind to their loved ones. If you have a question for us, please give us a call, 952-946-6205, or you can directly text us your questions at 612-999-3426. I'm Ken Haglind, and you are listening to Living Healthy and Aging Well.
I'm Rachel Schroman, owner of Schroman Law, and I believe you deserve information. Our firm offers free quarterly estate planning seminars at our office in St. Paul. At these seminars, you can learn the basics of estate planning from an attorney to help you determine which estate planning documents will meet your needs and goals in an efficient and cost-effective manner. You can learn more and register at our website, schromenlaw.com/events. That's SCHROMEN law.com/events.
Hi, I'm Corey Wisco, president of the Wellshire. The Wellshire is a community that provides memory care to its residents, and we have a location in Bloomington and also another one that we just opened in Medina, Minnesota. But the big question is that why do people come to Wellshire? Many of the people coming to Wellshire are coming from other memory care communities where they maybe haven't received bathing. They've had problems taking medication or inconsistency with staffing. Wellshire has never used a temporary staff. We always have our own people, and it's those people that make the difference. We have always felt it's so important to have 24-hour nursing in the building. The other thing is you have to have an amazing activity team. Nobody employs more activity people than Wellshire. Our activities begin in the morning, go all the way through the evening, 7 days a week. So if you have a loved one that needs memory care, come visit wellshiremn.com and book a tour today.
Hi, I'm Peter Solak.
And I'm Adam Ostrowski.
We are here at Woodland Stoves and Fireplaces to talk about outdoor fires. Sitting around a fire is the oldest, most basic form of human activity.
What's new is in the way fire is burned. We can show you how to burn cleaner with a lot less smoke.
The radiant heat and light from an open fire is unmatched. It kindles our spirits and connects us to the outdoors. And now it's easier to experience and enjoy.
Woodland Stoves and Fireplaces sells and installs wood and gas burning fire pits and fireplaces. Let us help you experience an outdoor fire without all the smoke.
Come see the many ways you can enjoy a fire outdoors.
Woodland Stoves and Fireplaces has over 35 working wood and gas units on display at the corner of East Franklin and Riverside Avenue in Minneapolis. More information at woodlandstoves.com. Find the fire that works for you. Woodland Stoves and Fireplaces, out of the ordinary products and services since 1977.
End-of-life decisions are not easy to make. Hi, I'm Mary T. of Mary T. Hospice Care. It's important to make sure that this difficult time is meaningful and comforting to you and your loved ones. Our hospice team provides an individualized program of physical, emotional, spiritual, and practical care so your loved one is comfortable and not in pain. At Mary T. Hospice, we understand that choosing the right hospice care provider can be overwhelming, but we're here to assist you. Learn more today at marytinc.com.
All right, welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Haglind, and joining me today is Tyler Leonard, President and Caregiver of SeniorAsset. And he is sharing how his companion care services can help improve seniors' quality of life and, just as important, give peace of mind to their loved ones. Tyler, how can our listeners contact you and your organization if they have questions or want more information?
Yeah. So my phone number, business phone number is 612-444-5611. Again, 612-444-5611. It ties into my cell phone, so it'll come straight to my cell phone. I've got a website, SeniorAsset, MN as in Minnesota.com. There's a contact form on there too.
Yep, on page 1 here. Yep, just scroll down. There it is. All right. Fantastic. Yeah, nice website. Looks great. Easy to navigate, folks. So feel free to jump on that during the show. All right, well, let's finish up our conversation from the first segment. I know you started your business right after COVID in 2021. What are some of the reasons that you started your business?
Yeah. So, I mean, like I was talking about earlier, I had to change careers. I just couldn't do anywhere near full-time computer work anymore because of the ongoing post-concussion symptoms. And then I always, like growing up, I always liked hanging out with my grandparents. My mom's dad, he'd come and we'd play Stratego and Risk. Always a blast. There's that. And then I was just looking for something like, doing different activities, getting out, interacting with people more. And when I met this woman, Stacy from Northfield, that was kind of, she pushed me to this field, and, along with the other stuff I was just talking about, I was like, okay, this seems like a great fit. Let's go for it. And launched it, and here we are 4 years later.
4 years later. Isn't that great? Yeah. No, that's fantastic. Well, I know people are curious, what are these services? Companion care services? What does that involve? So if we could maybe just walk through the services that you have. And I want to remind people that if they go to your website, SeniorAssetMN.com, you can just click on the top there, and it talks about the services that Tyler provides. So let's go ahead and just talk about those here.
Yeah, so the most of what I do is companion care. You might also hear companionship. So it's just one-to-one time with the senior. Most of my companion care clients have either Alzheimer's or another form of dementia. It doesn't have to be that way, but that's what typically that's what I do, companion care. And so there's two situations typically. So one is it's, say, a couple living together, or maybe a senior with an adult child, and that the person living with the senior that needs help is a full-time caregiver, and they're just looking for respite, which is really important. Like, if you're a full-time caregiver and you're listening to this, please find someone that that can give you a spell periodically. You need it to, like, A, take care of yourself, and B, recharge so you can be on point taking care of your loved one. But yeah, I do a lot of that respite care, just coming in, maybe a couple hours, once a week, twice a week, 3 times a week. Giving the primary caregiver a break. And then I also do a lot where it's just a senior living alone, whether it's on their own or in assisted living or memory care, coming in, being that, one-to-one friend. Like loneliness is, whether you're senior living with dementia or not, loneliness is a huge problem for seniors, for everyone. But so I'll come in, I might, activities we might do. I love cribbage. Client taught me how to play cribbage. And now I've had like 3 or 4 that I've played with, and some epic cribbage games. Playing games, chatting, looking at the newspaper, going for a short walk. I've got a client that if it's winter or the weather's crappy, we'll usually go to a museum. So, like, we went to the Mill City Museum the other day, which was honestly really cool.
Yeah.
And gone to a lot of other museums with her. If it's nice, we usually go bird watch. So things like that, getting out of the house, going for ice cream. I've got a client that loves this ice cream place, Pump House Creamery. I took him once. Now, like, it's all he talks about.
It's a regular, yeah.
Right. So, like, literally every week.
Give him a loyalty card there, yeah.
Yeah, honestly, yeah. But yeah, so it's just stuff like that, and every client's got different interests. I mean, I had a guy that I used to go antiquing with, which is nothing I would normally do, but his wife was like, he's super into collecting antique stuff, and so we go into Hopkins, bop around the antiques.
Yeah, they got some great places in Hopkins.
Yeah, there's 3 of them, right?
Right.
So that's companion care, and I would say typically it's 1 to 3 hours. Is usually a good length of time. 1 hour if it's just a check-in visit. Like maybe fixing a meal, like a quick meal, going on a short walk. Just making sure they're okay, and then 2 or 3 hours if we're getting out doing stuff, or doing that respite care. So that's the gist of companion care. There's a couple other things I do. So I take some clients to medical appointments. So that involves getting them there, waiting either in the lobby or going in and advocating. So, like, I got a client, I go in, ask questions to the doctor, report back to to his niece afterward. And then, funny, I don't know, slight tangent, but like I usually take him to Chipotle on the way home. He's obsessed with Chipotle, so he always enjoys that.
That's a great reward for then going to the doctor, and
he complains a good if he's listening to this, he'd chuckle, but he complains enough, so he deserves some Chipotle. And then I do some technology help, so just setting up new devices. I've done iPads, home phones, computers, and then just helping seniors use their devices. I guess printers are another break all the time. If it's mechanical, find somebody else. If it's like it's not connecting to the Wi-Fi or something like software related, I can usually figure it out. So yeah.
All right, fantastic. So companion care, respite, which is really critical. Maybe we'll touch on that on the next segment here. How important that is for the caregiver, medical appointment, transportation, and technology assistance. Well, you covered it all. All right. Well, it's time for a short break, folks. We'll be right back to continue our conversation with Tyler Leonard, president and caregiver of SeniorAsset. And he is sharing how his companion care services can help improve seniors' quality of life and give peace of mind to their loved ones. If you have a question for Tyler, please give us a call, 952-946-6205, or text us your question at 612-999-3426. I'm Ken Haglind, and you are listening to Living Healthy and Aging Well.
Dad, This is fun. I didn't think I liked kayaking.
Well, I'm glad you enjoyed it, but I think it's time to head back in.
Okay. Can we come back?
Sure. Hey, be careful getting out of the boat.
It's a kayak, Dad.
I'm going to return the kayak.
Can we walk home?
How about a taxi?
It's a short fare from your neighborhood to your naturehood. Visit discovertheforest.org to find a neighborhood park or green space near you. Brought to you by the Ad Council and the U.S. Forest Service.
It's no secret that medical care costs are soaring, with nursing home and skilled nursing care costs being some of the highest. You don't have to deplete your savings in order to receive long-term care. At Schroman Law, we work with families to develop and implement strategic planning for medical assistance for long-term care, for assisted living, nursing home care, or home-based care. Contact us today to schedule a free consultation at schromenlaw.com. That's SCHROMEN law.com.
Minnesotans age 65 plus might qualify for Health Partners Minnesota Senior Health Options. The easy all-in-one plan includes personal support, coverage for medical, prescription drugs, and dental, plus many extra benefits. Eligibility information is available at healthpartners.com/oneplan. Health Partners is a health plan that contracts with both Medicare and the Minnesota Medical Assistance Medicaid program to provide benefits of both programs to enrollees. Enrollment in Health Partners depends on contract renewal.
Hi there, it's Jennifer again. I just have to tell you how Hypercharge Wellness has been life-changing for me. After my very first session, I felt a new sense of calm, started sleeping better, and my mind just felt clearer. I still can't fully explain all the science behind it, but I have heard that it's also great for people with chronic conditions, and I can totally see why. Every visit, my lower back pain eases, and I just feel so much better overall. I really noticed when I missed a few sessions recently due to a busy schedule. I could definitely feel the difference, and I knew I had to get back on track. If you're dealing with fatigue, pain, or even chronic issues, you owe it to yourself to give it a try. They even offer a $49.99 introductory session and consultation. Call and get started at any of their 3 metro locations. Check out hyperchargeclinic.com and tell them Jennifer from AM 950 sent you. That's hyperchargeclinic.com.
This is Chad, owner of AM 950. Our station is located on a marsh, and we do our best not to disturb that environment. So I was thrilled to discover Natural Lawn. Their safer products and soil tests ensure that your lawn will be healthy, lush, and green. I don't even have to worry about bringing my furry friend to the station, thanks to the great care from Natural Lawn. I highly recommend Natural Lawn to keep your lawn beautiful, healthy, without compromising safety and sustainability. More at naturalawn.com.
With your AM 950 forecast, this is Adam. 66 cloudy and rainy today. Tonight, clouds and rain continue, a low of 61. Shanghai Wholesale Market and Market Fresh. Discover Market Fresh, your local Asian food store just south of Rosedale on County Road 36. And visit Shanghai Wholesale Market, St. Paul's Midway at 640 Pryor Avenue North. And this Father's Day weekend only, enjoy 10% off meats and seafood.
AM 950 KTN up, St. Louis Park, Minneapolis, St. Paul.
Saturday.
Welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Haglind, and joining me today is Tyler Leonard, president and caregiver at SeniorAsset. And he is sharing how his companion care services can just greatly benefit and improve seniors' quality of life and give peace of mind to their loved ones. Tyler, how can our audience get a hold of you if they have questions or want more information?
So my phone number is 612-444-5611. So again, 612-444-5611. My website is SeniorAssetMN.com. I've got a contact form on there. So if you want to get a hold of me by email, just shoot me a message through the website.
Yep, right on the bottom of page 1 here. It's the first homepage. So SeniorAsset, and asset is ASSET. So SeniorAssetMN.com. And Tyler is a great asset to all the clients that he serves. Before we return to our conversation with Tyler, I want to mention this radio show is brought to you in part each week by Minnesota Hospice. Minnesota Hospice is an independent, locally owned medical practice serving our Twin Cities communities with comprehensive end-of-life health care. The team at Minnesota Hospice provides patients and family members with award-winning end-of-life healthcare services. You may not be aware that hospice brings compassionate medical, social, emotional, and spiritual services to your home with typically no cost to you or your family. Please do not wait to learn how hospice care can benefit you and your loved ones. If you have any questions regarding end-of-life care or support, please contact the compassionate team of experts at Minnesota Hospice. They are available to answer your questions 24 hours a day, 7 days a week by a registered nurse. Their phone number is 952-898-1022. Once again, 952-898-1022, or visit them online at minnesotahospice.com. If you have a question for us, please give us a call, 952-946-6205, or just text us, 612-999-3426. Okay, Tyler, I've been doing this for a long time. I know some of the questions that I'm going to get here at the end of the show or after the show. And one of them, especially in your field, is, okay, what's the minimum amount of hours that you require for a client for your services?
Yeah, good question. So I just have a 1 hour visit minimum, which is pretty rare. Most places are 4 hours, some are 2 or 3.
Yeah.
But yeah, I mean, it's just me, so I can do what I want, and I don't mind doing 1 hour visits. I don't want to do like 5 1 hour visits in a day, but 1 or 2 of them is fine.
But it gives people a chance, though, to get to know you and see how their loved one, connects with you, and to build that chemistry. And then, a lot of times hours increase then.
Yeah, for sure. Yeah. Sometimes it starts with, just an hour once or twice a week and builds from there. And yeah, I mean, a lot of the time the 1 hour ones are just like check-in visits. So like I have a woman in Minneapolis I see twice a week. I go in, I chat with her. We usually go on a short walk. I'll heat up some lunch for her. We'll work on a puzzle. I don't play instruments, but she's got a piano background, piano, other instruments. So she'll give me piano lessons, which I always butcher. And
well, she's teaching you something. That's great.
It's
what
it's
a benefit.
I
Yeah.
do the chopsticks. It's
Right.
like,
Yeah.
oh,
Well, you know what? That's so important for her, though, because it'd be passing along these skills and these passions that they have is so important. As we talked about earlier, isolation, loneliness, boredom is what kills people. And it's, again, that I want to encourage people, think about just adding your services to their daily routine, because it really is something that they look forward to.
Yeah, it is. Yeah. I mean, my clients, I tend to have a good time with them, and they tend to have a good time with me too.
Well, let's also talk about your service area, because this broadcast does go out on the web and digital downloads and everything else, and it's across the country. But in terms of your focus here in the Twin Cities, what is your primary service area? So people that are maybe looking to contact you and get a consultation with you, what is that primary service area for you?
Yeah, I mean, I say if you're in Hennepin County, feel free to call me. I'm mostly like St. Louis Park, Edina, Minnetonka. I live in St. Louis Park. Kind of mostly the suburbs around St. Louis Park. But then like I've got a client in Bloomington. I've got some clients in Minneapolis. So I'll have days where I'm kind of like, going out that direction. But yeah, if you live in Hennepin County, feel free to give me a ring. Even if you don't, I do know some other caregivers in other parts of the metro. And yeah, I'm happy to, try to connect you with someone else if it's, whatever, a 40-minute drive for me or something.
Mm-hmm. Well, you also are part of a group that you founded called Navigate Aging. Do you mind talking about that for a few minutes here?
Yeah. I've gone to a lot of networking events, especially as I was getting going, just trying to figure out how to, I don't have any background in sales and marketing. So I was like, I don't know what I'm doing to try to find clients. So just try to, meet other people in this field. And I ended up, I met a lot of other people with very small companies, like one-person companies like myself, or what I have. And I ended up talking to some of them and starting a group. So there's 7 of us in Navigate Aging. Different specialties. So we have like a personal trainer that only works with seniors, mostly Parkinson's, a realtor who also helps seniors write stories about their lives, financial planner, independent medical or health insurance broker, social move manager. I think I'm missing somebody, but
there's a lot of people out there that can provide a lot of services and really make life easier for people. Yeah, no, that's great that you had that network and that you founded. I want to make sure we keep talking about some of the things.
Sorry.
No. This is great. We got so much to cover here, and we never will get it done. But what are some of the unique things that you have compared to other people, in your industry?
Yeah. So a few things. So I mean, it's just me. Most companies, most non-medical home care agencies are bigger companies. Say 50 to 100 caregivers. What I'm doing is pretty unique. I have all the same licensing. Like my business is licensed through MDH. I've got professional liability insurance. My car insurance covers me with clients. I'm CPR certified. I'm dementia care certified through the Alzheimer's Association. So I'm a safe option, just like a bigger company. But then you get you get that one-to-one relationship, that continuity of care that you don't necessarily get at a bigger company. And I can, I talked about this a little earlier, but I can communicate directly with loved ones, which is, a huge thing for a lot of my clients, just to, have that, whether it's a text or, phone call, email, depending on urgency and preferences, just to get an update, know what's going on. I also take, good care notes. So there's that. And then my minimums, we talked about this, but just having that 1 hour minimum is unique. And I don't have a weekly minimum. So I do have some clients that, just use me occasionally, especially with like the tech help and medical appointment, transportation stuff. That's not something that's typically needed on a regular weekly basis. Those are some unique things.
So typically, who are your clients? I mean, what if you had to kind of categorize what your typical client looks like? Who would that be?
So like most of what I do is the companion care, and the typical companion care client is, someone in 70s or 80s. Typically, I've worked with people in 90s too. Has Alzheimer's, another form of dementia, usually early stage, maybe middle stage, maybe aphasia too. I have a couple clients with expressive aphasia. Maybe what they say doesn't really make sense, but you can nod and agree, and they're still maybe walk unassisted or with a cane or walker. Interested in different, maybe not all of the same things as before, but still have some interests. And that's my typical client. It could be, I also see some random, like people that I've taken to colonoscopies, cataract surgery, other procedures where it's just like they need someone to be there at the appointment the whole time or at the procedure.
Yeah.
So I have clients like that are healthy, otherwise healthy seniors.
Well, it sounds like you're a jack of all trades in a sense. I mean, you do get a lot of different services with you, because I know many home care services don't allow their caregivers to drive people to appointments. It's just not out. It's just outside their scope. And it sounds like whether you're helping them with technology or helping train them on how to use technology or taking them to appointments or being an advocate. And again, the other thing I want to mention is the respite care is so important. We keep focusing always on the client or someone who needs the care, but that caregiver needs a break too. And I don't think they sometimes realize how much they need a break, because they've been doing it for so long, and actually getting away, knowing there's someone there that they can trust to watch their loved one while they go and do grocery shopping or just meet with their friends, socialize outside of the home. I think that's also a great benefit.
Thanks. Yeah. It really is. I mean, there's a client I used to see who passed away, who I'd see him 3 times a week. We'd walk from his building to the Edina Senior Center next door and play pool, which was really fun. His wife was, I could tell when I started, she was exhausted. And it was just nice, sometimes she'd stay at home and just get caught up on paperwork type stuff. Sometimes, she'd go get coffee or lunch with a friend. yeah, I mean, it's, whether it's getting caught up on stuff or just recharging, it's definitely crucial. I mean, I got 2 young kids, and it's like, I don't, like, my wife and I don't get a lot of breaks. We don't have much help outside the house, but occasionally we do. And, especially if parents are in town, and it's, whether it's, so I guess I'm saying, whether you're caregiving for a child or, an adult, it's, you do need, you need to recharge sometimes.
Well, and the thing I found too is that because you're so committed and you're caring, you kind of forget about yourself. You're the caregiver, and sometimes it's nice to just be the spouse or the child or the adult child, and to be able to be in that role versus in a caregiving role. And it's nice when someone like you can come in and let the spouse be the spouse, and let the adult child be the child, or whatever it is. I think that is really a great benefit as well.
Thanks. Yeah. I totally agree. Yeah, you gotta do the things that make you still, even if you can't do them as much as you want to.
Right. But again, it elevates your energy so you can be a better caregiver.
Yeah.
And I think people have to put their face mask on first before they put the face mask on other people, and when the plane drops those face masks on you. So it's just really important to think about a balanced, a life balance that goes on with both the caregiver and the patient or the client.
Yeah, that makes sense.
Sounds good. All right, it's time for a short break, folks. We'll be right back to continue our conversation with Tyler Leonard, president and caregiver of SeniorAsset. If you have a question, please give us a call, 952-946-6205, or text us, 612-999-3426. If you have a question, this is the last segment here we're going into, so please feel free to give us a call or a text. And I'm Ken Haglind, and you are listening to Living Healthy and Aging Well. We'll be right back.
End-of-life decisions are not easy to make. Hi, I'm Mary T. of Mary T. Hospice Care. It's important to make sure that this difficult time is meaningful and comforting to you and your loved ones. Our hospice team provides an individualized program of physical, emotional, spiritual, and practical care so your loved one is comfortable and not in pain. At Mary T. Hospice, we understand that choosing the right hospice care provider can be overwhelming, but we're here to assist you. Learn more today at marytinc.com.
Hey, listeners, there's an exciting invitation for you. This Juneteenth, come celebrate with Minuteman Press Uptown, the largest Black-owned print shop in Minnesota. On June 19th, you're invited to tour your favorite local union print shop. It will be a fun experience where you can see creativity in action, enjoy refreshments, win prizes, and learn about their important role as the only BIPOC union printer in the Midwest. Mark your calendars for June 19th at 4024 Washington Avenue North in Minneapolis. That's 4024 Washington Avenue North. See you there.
When was the last time you had your roof inspected for extreme weather and hail damage? This is Chad, owner of AM 950, to talk about the exterior construction company I trust, Snap Construction. If you've noticed new roofing projects in your neighborhood, your home was likely hit by hail last summer and experienced damage. Snap Construction is helping homeowners like you, and they're the roofing specialists I trust. They are the most well-reviewed contractor in the Twin Cities and have a ton of positive customer reviews from homeowners just like you. Even better, Snap Construction's installations are backed by a lifetime warranty, so you know you're dealing with a qualified roofing expert. You want to work with a company that will be here for a long time after the work is done. Snap Construction has handled thousands of claims and will help you through the process. Do yourself a favor and get a free roofing inspection so you have the facts and peace of mind you deserve. Call Snap Construction today at 612-333-SNAP. That's 612-333-SNAP. Or visit snapconstruction.com.
Your heart beats for generations.
Your heart is so many things. It beats all the time, and it works very hard to keep you moving through your day, keeping your thoughts clear. It's the most important organ in your body.
Every beat of your heart tells a story of love, resilience, and hope. Taking care of your heart means creating more moments with the ones you cherish. Learn more at hennepin.us/heart-beats. That's hennepin.us/heart-beats.
This is why you work so hard to pay the mortgage. Because home is more than four walls and a roof. It's that porch swing on a summer evening. It's everybody over for Sunday dinner and your family sleeping in their own beds at night. Making home affordable is a free government resource that can make paying the mortgage easier. Call 888-995-HOPE or visit makinghomeaffordable.gov.
Good night, Mama.
This is why. Brought to you by the U.S. Treasury, HUD, and the Ad Council.
All right, welcome back, everyone. You are listening to Living Healthy and Aging Well, where we talk about helping you and your loved ones improve and enjoy your quality of life. My name is Ken Haglind, and joining me today is Tyler Leonard, President and Caregiver of SeniorAsset. And he has been sharing how his companion care services can really benefit and help improve seniors' quality of life. And as important, give peace of mind to their loved ones and give them a break, give them a little bit of a respite, which is so important to prevent caregiver burnout. If you have a question for us, please give us a call, 952-946-6205, or text us at 612-999-3426. Tyler, how can people get a hold of you if they have questions or want more information?
So my phone number is 612-444-5611. Sorry, I was a little away from the microphone there. Hope that didn't sound weird. 612-444-5611. My website is SeniorAssetMN.com. MN is in Minnesota. Asset is ASSET. Yeah, and you can just go to the bottom of the homepage. There's a contact form where you can call me, text me. If you use that phone number, it comes to my personal. It's a business number, but it comes to my personal phone.
Mm-hmm. And so some of the things that it sounds like, as we talked off the air, one of the things that people really appreciate about you is that your responsiveness. I mean, you get back to them right away. I mean, it's as a sole proprietor, this is your business, this is your life's work. And so you are very responsive. And so I know a lot of people, as we talked earlier in the show, communication can be frustrating in getting feedback, getting callbacks, just that. So again, that's one of the benefits that you have been reminding us, is that as you as a caregiver and as the owner of the business, you can give information back directly to them, not through a third party, and they get a chance to really talk first person with you on how things went with their loved one.
Yeah, for sure. It's a huge piece. I mean, if you're with a bigger agency and you're really hoping, or if you're using a bigger agency and you're hoping for that communication, you're dependent on the caregiver reporting to the office staff and then the office staff reporting to you. Whereas I can literally call you or text you when I'm with your loved one if needed, or otherwise, let you know after. So yeah, that's a huge, huge selling point for. I mean, it's not as important for respite care because but yeah, for clients where it's companionship but not respite care, it's really important typically.
Do you ever the loved ones ever want to have a FaceTime call while you're there, or people that are out of state or maybe unavailable to catch up with their loved one?
I guess actually, so I had one client that I used to see. He had a bad stroke several years ago. Sister lives out of state, and I would every time I saw him, I would call her and we talk for 5 minutes, which
nice.
Yeah, they both loved. Yeah. I mean, honestly, I don't do that often, really, just with him. I mean, I had another client, had a crazy situation, kids out of state, he deteriorated, they weren't really aware of it, visited him, we're like, oh my God. So I'd be on the phone with his son a lot while I was with him, but it wasn't really just hey, catching up. It's hey, this is the grocery situation. These are things you should order for the next time I'm here. Your place is a mess. I can get a cleaner over here. Do you want me to do that? It's that kind of stuff. Which I do. I guess that that gets back into the communication. Like that was
Right.
a client where, that was really crucial. I ended up referring him to a social worker who ended up connecting him with hospice, and also like a cleaner, a handyman, and dealing with the groceries, and then also doing, the son said the dad's not a trusting person, but he ended up sent me a really nice message after he passed. It was like, he grew to trust you, which is, I don't know if I can do, do stuff like that and actually make a difference, make a difference in the loved one's life. And then also, end of life, it was end of life for this, really end of life for this client. It's awesome.
Yeah. Yeah. Well, it's amazing how many things that people need as they age. And sometimes it's so easy to overlook those things. And it's great having somebody there on site, getting to know somebody, know their preferences, know their likes. I just love the story about the Chipotle or the ice cream trips. Those mean so much to people. And of course, the loved ones, just the peace of mind, knowing that there's somebody there adding that quality of life is just crucial.
Thanks. Yeah.
That's great. That's great. You're doing that. So I know some of the things that people would text in here is, so you have 1 hour minimums, which is absolutely unusual in this caregiving industry. And then you bill once a month. And so it's very easy. You're a sole proprietor. People can just get a hold of you and work with you directly on the needs. You really can customize the needs that you can provide for their loved ones.
Yeah. I've got clients that I just see occasionally for the transportation, or I've got clients that I've seen once for tech help or twice. Got whatever the needs were done, and that's it. And then I've got clients I see a few times a week. Maybe I actually started companionship recently with a client who was initially for tech help, and then kind of something happened with another caregiver, and he asked if I could start doing companion care too, and his conservator was on board, and it kind of a whole range of anything from a few visits a week down to just the occasional visit is stuff that I do.
Yeah. Well, I'll tell you, getting the chance to know you over this hour has been fantastic. I can just tell you, listen, the audience, you are very authentic. You take your job very seriously. You have a great outlook, and you understand the needs of our senior population. And you've been doing this for 4 years, and you're doing great. And you got a great future ahead of you with all the cares that are needed here. And we need more and more cares as time goes on.
I appreciate it.
Yeah. Great to have you on the show, Tyler. All right, it's the end of the show, folks. That was fast. I want to thank Tyler Leonard, president and caregiver of SeniorAsset, for taking the time to talk about his companion care services that can help improve seniors' quality of life and, as important, give peace of mind to their loved ones. Tyler, how can our listeners contact you or your organization if they have questions or want more information?
Phone number is 612-444-5611. And then my website is SeniorAssetMN.com. And there's a contact form on there that goes straight to my email.
All right. Well, Tyler, thank you for joining us today. We hope you enjoyed today's show, folks. Please continue to give us a call with questions or comments you have regarding today's conversation. You can reach us anytime by voice or text at 612-999-3426. Until next time, choose to live well.
Do you have a loved one who is not receiving the care that they deserve at their current memory care facility? I'm Ken Haglind, Director of Community Relations here at the Welshire, and I meet with families